Welcome to the latest edition of Health Matters, which focuses on HIV testing. My name is Dr. Alison Brown and I work as Principal HIV Scientist at Public Health England. This week, we've released our most recent HIV data, and over 100,000 people are estimated to be living with HIV in the UK. This number continues to rise because HIV treatment, antiretroviral therapy, is so effective that people with the virus can expect to live well into old age. However, challenges remain and transmission is continuing, particularly in gay and bisexual men, and 2 in 5 people are diagnosed late, which risks early mortality and onward transmission. HIV testing is critical to the public health response to the HIV epidemic, and we're here today to discuss the benefits of HIV testing, how easy it is to have an HIV test, and how to talk about the best ways to provide HIV testing for those most at risk. Joining me today are Robbie Curry, Sexual Health Programme Lead in the London Borough of Bexley, Mark Thompson, Coordinator of the Peer Mentor Programme Positively UK, and Carrie James, Head of Programmes at the Terence Higgins Trust. So Carrie, I'm going to start with you. So the World Health Organization and UNAIDS have provided a clear pathway through the 1990 vision to eliminate HIV-related mortality and transmission by 2020. Can you tell us more about the goals of the National HIV Program and why it's important?
Well, I think of all the goals, the most obvious one for this discussion is, to increase HIV testing among those groups most affected by HIV. And the most high-profile thing we do to do that is National HIV Testing Week, which is happening this week. So this is quite timely, really. And it's really started 3 years ago, and it's gained momentum every year. And this year we're expecting 400 organizations to take part. We're shipping almost 1 million individual resources to all these organizations. So leaflets and pamphlets and posters. There'll be outdoor advertising in 16 UK cities. So it's really like one really high-profile event of the year to really promote HIV testing. But it's not just going to take promotion. It's also going to take using new testing technologies to increase testing. So that's one thing that the program is really focused on, not only integrating those programs into our program, but really skilling up the sector in order to use them more effectively. So we just had an expert seminar on Monday about new testing technologies, so self-testing and home sampling. And we really focused on not only what the technologies are, but how they can be used in community settings. So I think that's really important. And the other really important thing that we've been involved with is the promotion of the National Home Sampling Program, which has really been a really huge success, funded partially by Public Health England, partially by local authorities. And this year during National HIV Testing Week, we're hoping to generate 20,000 orders within the next 2 weeks. So that's a really big, exciting thing. And one thing that we do know is over a third of those people ordering those tests had never tested before. So it's not like we're taking people out of clinics and we're testing them in a different way. We're actually testing new people. And if we are going to reach that first 90, that's exactly what we're going to need to do.
Thank you very much. So Robbie, can you tell us about the Londonwide HIV prevention programme and how each London council contributes to the achievement of its goals?
Yeah, sure, of course. The Londonwide programme is a programme that's supported by all London boroughs. They contribute financially and with additional kind of resources. Those resources are worked down on a proportionality basis. So if an area has a high prevalence of HIV, for example, they would obviously contribute more. And then as a consequence of that, the London Borough of Lambeth actually hosts and manages the programme. And I think it's really important to recognise their amazing contribution to that programme. They absolutely lead it. They hold the programme together. London is incredibly diverse, as are the councils and their structures. So actually holding that together in itself is a huge achievement. The programme, the work of the programme complements the national programme, but the Do It London kind of campaign works on multimedia channels, using sort of Facebook, social media, traditional kind of media to create sort of an ambient background population response. And then we've got a condom distribution scheme and outreach work that goes out into the community. So all of these things kind of come together, they're distinct, but they also cooperate and complement each other. So London deserves to be very proud of its London-wide programme.
Okay, thank you. So Mark, we know that HIV disproportionately affects African communities. Can you tell us about some of the challenges in increasing HIV testing in these populations?
Yeah, sure. I think there are 3 key areas we need to focus on if we're thinking about increasing testing in African communities. I mean, first of all, there's stigma. There are still very high levels of stigma around HIV in the general population, but specifically if we're talking about Black African communities, and that's related to a number of issues. First of all, that there's still a low levels of knowledge around HIV in the community. It's associated with illness, with death, with disease, and that continues to prevail throughout the community. So we need to increase people's understanding of what HIV means in 2016. If you're diagnosed today, what that means, and also people understanding that what undetectability means, what uninfectiousness means in the community. I think then there's the issue around knowledge and awareness. I think many people in the African community don't actually know about the numbers, the levels of HIV and what undiagnosed infection means in that community. And there's been excellent work which has been done to take HIV testing into the community, and as Kerry said earlier, using outreach, community events, home testing, home sampling, all of these things are a really, really good step forward. But I think unless we start to address the issue of stigma and raising awareness, and also making people aware that, you know, that this is still an issue for African people.
Thank you very much. So Robbie, coming back to you, you're also co-chair of the English HIV and Sexual Health Commissioners Group. Can you tell us about some of the common issues when commissioning HIV testing services in the community?
Yeah, sure. I mean, I think certainly what Mark was saying and Carrie have been saying already is that HIV disproportionately affects certain kind of communities. So it's absolutely right that we recognise that and sometimes take HIV testing and STI services into those kind of communities. But that's not so straightforward. We obviously need to make sure that the community workers' organisations are skilled, competent, knowledgeable, can do the necessary onward referral processes. And all of that then comes down to how well they are trained, how well they are commissioned, quality assurance, and all of those things, which is really important. But I think one of the challenges at the moment, which I think we tend to kind of overlook really, is that obviously putting HIV testing into the community, its function is to diagnose undiagnosed HIV infection and get people onto all the excellent pathway of care that does exist. But we kind of forget a little bit that sometimes actually just taking HIV testing into the community and you're testing people in HIV negative is an intervention and is a really positive outcome. We can then obviously engage people that do not have HIV infection in health promotion interventions so that they can stay negative. We kind of forget some of those things sometimes.
Thank you very much. So Mark, coming back to you now, you're coordinator of the mentoring programme at Positively UK. Can you tell me what support is available post-HIV diagnosis?
I mean, first of all, I think we're very fortunate in the UK, in this country, that if you're diagnosed with HIV in 2016, there's excellent support, there's fantastic clinical care. People will be plugged straight into clinical services. They'll see a clinician, a health advisor, a clinical nurse specialist, a pharmacist. All of these things will be dealt with, and we dealt with very, very fast, which is good news. And the prognosis is good. You're going to live a long and healthy life if you're diagnosed in 2016. I think around the country that we have to look at what happens in the community when people actually leave clinic. We're dealing with people's clinical needs, which is fantastic. We have to deal with their community needs and their social needs as well. So there are still community and voluntary organisations that are available to people, but as we've seen, because of the current financial climate, some of those are under threat and they're not available as they used to be. I think what has also happened for some of those community services is the needs are shifting, and they're seeing more people who have HIV, not just presenting for emotional support, but practical and social support. So issues such as poverty, migration, changes to the benefit system are all there. But I think one of the most special things that's really available and has always been incredibly important is peer support, and these are people with HIV supporting other people with HIV. Positive people have always been central to providing some sort of support and have been the backbone and sometimes the driver, and we continue to be there. And I think that what we're seeing now is a move to providing a more structured and robust programme of peer support. So the project I work on, Project 100, is a national programme which aims to train people with HIV to work in clinics alongside healthcare teams to provide a range of support interventions, from treatment to disclosure to just accepting and living well with the condition.
Thank you very much. Moving on to Carrie now. So Carrie, can you tell us more about the It Starts With Me campaign?
Absolutely. So It Starts With Me campaign started a few years ago now, and we kind of relaunched this year. And what we really wanted to do this year was really put the campaign more in the context of people's lives. I think, HIV and sexual health, they don't happen in isolation, you know what I mean? You just can't tell people a bunch of facts and expect them to always make the most rational decision at very irrational moments in their lives. So what we wanted to do with the campaign is not only give people the information that they needed, but also connect with them on an emotional level and also in a social proof level. So when we went out to find people for the campaign, we recruited from the community, and we really talked about them about their stories, why they wanted to be in the campaign, why this was important to them, and really made sure that the people that we were choosing were people that really wanted to do something within their communities. So then when we did the pictures and we were telling the stories online, we're telling their stories. We're not just telling the story that we want them to tell, we're telling their stories. And I think one really good example of that is one of the models named Adam. When he came in for the interview and we were talking to him, he was just very clear. He's like, I'm not afraid of HIV. I know people who are HIV positive, they're absolutely fine. I don't want to get I don't want to become HIV positive myself, so I use condoms and I go and get tested, but I'm not afraid of it. I don't see why people should be afraid of it. So that was one of the things that was so strong, such a strong message, and that was one of the main messages that we launched with, was a picture of Adam with him saying, I'm not afraid of HIV, which is a very powerful statement to say, I think, especially from organizations. I think, for a long time, even though we weren't using fear in campaigns, we like people to be kind of anxious or nervous. So now we're saying that, we don't want you to be afraid of HIV, but we do want you to do what's necessary to protect yourself from it and to live a healthy life. So I think that was one thing that was a big change, and that's really, really important. That kind of authenticity through the campaign, I think, is really important. As I mentioned before, providing really practical solutions to the behavior change that we want people to make. So not just telling someone that they should get tested, but offering them new ways to make testing easier. Not just telling someone that they should use a condom, helping them find a better condom, and then helping put that condom in their hand at the time that they need it. So all of that kind of stuff is really important. And I think the third thing that was really important for the new It Starts With Me was the idea of really embedding HIV prevention throughout the healthcare system. So not just in GU clinics, not just in HIV organizations, but also in GPs, in primary care, in faith settings. We really want, if we're going to really hit that first 90 and really solve the HIV situation, the scale of the testing and the scale of the change is not going to come just from GU clinics or HIV organization. It has to be the entire system approach, and that's really something that we're prioritizing with this new contract and over the next 3 years.
I'd like to thank our panellists today, Carrie James, Mark Thompson and Robbie Curry, for an interesting and stimulating discussion on HIV testing. HIV remains critical to the public health response to the HIV epidemic. Regular testing reduces the number living with undiagnosed infection and ensures those with the virus are properly linked to care and treatment so that they can live long and healthy lives. In addition, we know that HIV treatment is so effective that those who have an undetectable virus are no longer at risk from passing on their infection to sexual partners. It's essential we capitalise on this good news and encourage people to have an HIV test so that they can take control of their lives, their health and the health of their partners. Do please take time to explore this edition of Health Matters, which makes a case for improving the coverage and uptake of HIV testing. It includes links to a variety of practical tools, infographics, case studies and blogs. Thank you for watching.